Hello everyone, welcome to Triscale Massage and Bodywork. My name is Bill Bryan. I'm a Pennsylvania licensed massage therapist. I've been in practice since 2001. And in that time period, I have seen a lot of back injuries. Low back injuries, neck injuries, acute injuries, some not so cute, and chronic injuries. And today I want to share with you a very powerful self-care technique that doesn't cost any money, can be done anywhere. It can be done without negative side effects. And most importantly, you don't need any extra equipment because you've got all the equipment you need. So today we're going to be looking at using Qigong to decompress the spine. But first, the information in this video is for informational or educational purposes only. It does not substitute professional medical advice or consultations with healthcare professionals. In other words, please don't go into your doctor's office and say, but Bill said this or Bill said that. The purpose of this talk is to acquaint yourself with your own body, with the parts, with what goes wrong with them, especially in this case as it relates to back injuries, and so that you can ask better questions and know what options are available and make choices. So I'm not telling you what to do. I'm just going to tell you certain things to think about while you're making your decisions. All right, let's talk about back injuries. Back injuries are very common. It's most of what's walking in through my door, and probably chiropractors, doctors, acupuncturists. We're all making actually a lot of money off back injuries. It's a very common injury. In fact, if you have friends, if you know people, you probably know people who have back injuries. So too, the advice that we're given or the approaches that are suggested to a back injury are also pretty common, and I break them into a couple basic categories. So if you have a back injury and you go to your doctor, you're probably going to be offered medication. Medication will be a painkiller of some sort, either tranquilizer, muscle relaxer, or an anti-inflammatory, corticosteroid shots, things of this nature. This is a medical approach to a back injury. The goal in that is to take away the pain, to take down the inflammation, to do away with the pain signal in some way. It's not solving the problem, it's just solving the pain part of the problem. Okay, I have a lot of clients that say, oh, I got the corticosteroid shot and you know, boy, that really solved the problem. It fixed me. Well, no, it didn't. It made the inflammation go down. It didn't make the injury go away. So sometimes there's a place for medication. I'm not running it down, but just be aware of what it's accomplishing and what it's not. The second thing they offer is physical therapy. Usually you go to your doctor and you get a script for your pain meds, and then you get a script for PT. And in PT, they're going to focus on primarily two areas. I mean, PTs can vary, and there's some really good ones out there, and there are some out there that, quite frankly, I wonder why they chose the profession. But usually when you go to PT, they're going to do stretching and core strengthening. And these have their place. They can be overdone. Depending on the injury, they may or may not have an effect. We're going to talk about core strengthening later when we get deeper into what to do about back injuries. But the third thing that is usually offered to us is surgery. Basically, if the first two don't work, then we start seeing specialists and they start talking about cutting and snipping and cauterizing nerves and things of that nature. And ideally, we want to avoid if not some, all of these three typical go-tos that conventional medicine has to offer. I'm going to break this talk down into 3 parts because we have a lot of material to cover. And if you can just like get to part 1 and get through that, take a break, come back next day, maybe check out part 2 and part 3. That way, you know, you're not being overwhelmed with all this information and your eyes glazing over, and it's not a good look. So part 1 will be anatomy and physiology. Anatomy is what are the parts, and physiology is how do the parts work. So that's anatomy and physiology. Part 2 will be pathology, which is basically what happens when the parts aren't working the way they're supposed to. There's a disease state, there's an injury, something of that nature. Then we're going to move into part 3, which is where we're going to draw on the discipline of Qigong. I'm going to extract out of it something called the Wu Qi posture. It's the posture that all Qigong and Tai Chi start with, is the Wu Qi posture. It has many benefits for health, but I'm going to be focusing on it specifically for the purposes of decompressing the spine and helping to alleviate back injuries. So let's get started. We will begin by looking at the anatomy and physiology of the spine. I know you're excited. All right. Anatomy and physiology. Like I said, anatomy is what are the parts? Just what are their names? And then physiology is what do they do? How do these things interact with each other? How does the body behave? All right, the back. I have a client who she always would refer to her backbone. And when I said, you know, it's not just one bone, and she was amazed by that. All this time, and she was up in her 70s, all this time she thought that her backbone was a solid bone. So let's start there. Let's correct some misinformation regarding our spinal column. This is our friend Spiny Norman. For those of you familiar with Monty Python, you'll get the reference. Okay, so behold the spinal column. This marvelous bit of engineering is comprised of 33 bones. There are 24 vertebrae. There are, spin it around this way. The sacrum is made up of 5 bones that fuse together, and then at the base of the sacrum is the coccyx, or the coccyx, which is 4 bones that fuse together. So we have 33 bones in all. And something I want you to notice about this right off the bat, the top of the spinal column is thinner, and then it keeps getting thicker as it gets down bottom, so it kind of tapers. And that is because this is a column. I want you to think of this as a column, a weight-bearing column. So your skull is up here, and then the shoulders are hanging off it, and your ribs, and all your intestines, and heart, and lungs, and all your viscera. All of that is coming down on this column. So the column starts thin at the top because there's less weight bearing, but as we move down the bottom, it gets thicker and thicker for more weight. And as we get into our discussion about compression, you'll see why that matters. Another thing about the spinal column, it has this nice kind of a curve to it. And the reason that there's a curve in the spinal column is because if it was a straight on like a shaft, if there was force, it would drive right down into the sacrum. Okay, so if this was a perfectly straight aligned bones, then every time you jumped, anytime you banged your head, anything, all the shock of that, the impact would go right into the low back, into the sacrum, into the pelvis. Here, because it has this curvature to it, it acts as a compression spring. So when we get force, it can compress and then open back up again. What else do we need to know about this? Let's look at, here we have the vertebra. We mentioned that the back is made up of 24 vertebrae, and they're all stacked on top of each other. The vertebra up in the neck are called the cervical vertebra, and there's 7 of them. On an MRI, they'll be listed C1, C2, C3, right? Cervical 3, cervical 6. So they're the neck vertebra. Then there's the thoracic vertebra. The thoracic vertebra are the vertebra, there's 12 of them. So thoracic is T, T1 through T12. And these are the vertebrae that our ribs are attached to. Then we come down into the lumbar vertebra, which are the 5 at the base of the spine. And if you notice, again, the body, this is the vertebra turned up on its side. The body is much bigger than the thoracic, which is much bigger than the cervical. So we have these 5 lower lumbar vertebrae, then we get into the sacrum and the coccyx. Something else to pay attention to, it's going to come up and you'll see it on the MRIs. Do you see these little gaps here, these little holes? These are called foramen. They're not really holes, they're openings. And they're openings through which the nerve roots break away from the spinal cord into the rest of the body. So these foramen are very important, and you'll see on the MRIs narrowing of the foramen or stenosis, and they'll be talking about the health of the foramen, because with the nerve roots coming out of there, in fact, I think the next picture, yeah, here's a better shot of this. So this is one of the vertebrae, again, turned up, right? Here's the body. This is the part that the disc sits in. We're going to talk about the discs in a minute. Then on the back of the vertebra, you'll notice there are these kind of projections. These are called processes. And you don't have to know the names of them for the test, but it's important to understand what role they serve, okay, how they function. These processes, these are called transverse processes because they're on the transverse plane. And then this is the spinous process. That's the process that you can spot in people, and you can feel the bumps along your spine. They're actually the spinous processes. In between them are these little guys, and they are facets that join with the vertebra below it. So what you have is the body of the vertebra. This big area is the weight-bearing part, but this area is where the hinging takes place. It's where the bones are connected, and when they're bending back and forth and twisting, it's these little guys that are actually the hinges that are allowing that movement to take place. In the middle, we have the central canal zone, or the area where the spinal cord travels through. And as the spinal cord travels through that area, I don't know if you can see here, but the nerve, there are little nerve roots that leave out of those foramen. That's why they're called neural foramen. It's the nerve. Neural means nerve. Let me see. Anything else we need to know about this? I don't think so. We're going to be coming back to the neural foramen, which are like here. Okay, these is where the nerve roots exit. We will be coming back to that in our discussion of discs and sciatic pain and things like that. All right, let's look at the discs. In between each vertebra, here's the body of one vertebra, here's the body of another vertebra, is a cushion. And this cushion is this Think of like, I know people like to use the analogy of a jelly donut, and I guess that's an okay analogy, but it's not totally accurate. The cushion is this fibrous material that kind of wraps around on itself, more like a jelly roll than a jelly donut, and that's called the annulus fibrosus. Okay, the annulus fibrosus is this fiber that it makes like a circular disc. Inside that disc is the nucleus pulposus. That's the jelly that is like a cushion inside the disc. Again, I don't like the jelly donut analogy because, and even this picture, it kind of makes it look like there's just this one pocket of jelly in here and then everything else is fiber. This jelly in the center stays in the center, but when there's compression, it makes its way out through the labyrinth of the fibers of the disc. So the jelly will spread out and then come back in again, depending on what's going on with the force on top of the vertebra. Okay. And I guess something else to point out here is the end plate, that you'll see reference on MRIs to end plates. The end plate is this part of the body of the vertebra. And if you notice, it doesn't sit directly on top of the disc. It has this bit of cartilage. So it's again, brilliant design. I mean, we really are carefully and wonderfully made. The other thing to know about the spine is that, like we said, there's 24 of these vertebrae stacked on top of each other. They are surrounded and supported by muscles. We mentioned the transverse processes and the spinous processes earlier. And I said you didn't have to know the names for the test, but at least know what it does. All these little muscles, these are called the rotatories and the multifidi. And if you notice, they have this kind of a Z shape, like a truss. It's a truss system. And that Z shape, those muscles are attaching to each of those processes. Okay? That's good to know because this is where we have some control. These are fast twitch muscles. So what that means is there's slow twitch and fast twitch. Slow twitch are making thousands of little micro adjustments without you even thinking about it. But by equal tension up alongside of the spine, they keep the spine erect. They can curve it. They can bend it. Think of this as if you've ever seen an antenna tower that has a Z shape, and that's what gives it its strength, so that when the wind is blowing, it doesn't rack or it doesn't twist. That Z pattern gives it tensegrity. Now imagine that antenna tower with the ability, if instead of all those little rods, if each one was a little pneumatic pump that could lengthen and shorten in contrast or in relationship to forces placed on it. That's what these guys do. These little muscles can shorten and contract and move and adjust how the vertebrae relate to each other. In addition to the truss system, and I guess in keeping with the radio antenna analogy, antenna towers have guy wires. Well, we don't have guy wires, but we do have the erector spinae group, which is a large muscle group, runs up either side of the spinal column. And we have latissimus dorsi, quadratus lumborum. I had to fact check myself on that. Quadratus lumborum running from the top of the pelvis up into the bottom ribs. There's also, not in this picture, but the psoas muscle, which attaches kind of down here inside the groin and runs up through the pelvis and attaches at the lower back. And that also guides where the back goes. When the one tightens, the back goes this way or that way. So we have all these muscles, right? And their purpose is to keep the spine erect. The main thing to take away from this is these muscles have to have equal tension on either side of the spine, because the spine is going to go wherever the muscles pull it. They're just a bunch of bones stacked on top of each other, so they can bend and twist. Whatever these muscles are doing is going to affect what the spine is doing. The last thing we want to look at, and this is actually the one we're going to be focusing on the most in part 3 when it comes to the Wu Chi position. And that is the role that fascia plays in our posture, the role that fascia plays in our spinal column and its health. Anyone who knows me or has come to see me for an appointment knows that it doesn't take long before I start talking to them about their fascia. And fascia is basically the connective tissue that gives us our shape. It gives us our posture. Most of us think of our skeleton and our muscles as giving us our posture, but really it's our fascia. And the fact is, everything is suspended in fascia. Your bones, your muscles, everything beneath the skin, starting from the skin down, is encased in and surrounded by fascia. And this is why I believe it is possible to decompress the spine using the fascial tissue. So before we get any further into that, let's talk a little bit about what fascia actually is. Behold, the wonderful land of fascia. And I know it looks like the scene from the Lord of the Rings movie, but this is fascia. This is a network of collagen fibers and elastin fibers woven through reticulin fibers. So it's like it really is a fabric, but it's a self-adjusting fabric. It's a fabric that it's not stagnant. It's able to detach and reattach in another place. It has amazing properties to it. When fascia expands and contracts, it actually generates minor electrical currents. It has piezoelectric properties. But the main thing that we want to look at with fascia is the role that it's playing in tensegrity, the role that it's playing in our posture, in keeping our shape. Like I said, it grows like a fabric, and it can start to grow in thick bands, depending on where it's needed and the job that it's doing. For instance, the first image we saw, and possibly this, is what would be known as subcutaneous fascia. It's the fascia that exists right under the skin and that holds everything in place below it. But then that continues to the muscle, and then it wraps around the muscle. That type of fascia is called myofascia. And it will begin to behave differently from subcutaneous fascia, and it will grow differently than subcutaneous fascia because myofascia has a different purpose and a different function. A lot of you have heard the IT band, iliotibial band. It's a band of fascia that runs down the side of your leg and actually wraps around to the knee. This would be an example of subcutaneous fascia, and if you see, it's much more organized in length than the previous pictures, which are kind of more all over the place. That's because the IT band, this fascia, has a different job to do, and it's needed for strength to keep you, bringing you back to center. So fascia is our primary go-to, and it's what's going to make this talk different than the conventional methods. Because if you remember, the conventional go-tos are medication and PT, and if that doesn't work, surgery. And I want to present fascia as a viable go-to to decompress the back and to help with back injuries. As I said, fascia grows in bands. I'm pretty sure these pictures were taken from Thomas Meyer's book, Anatomy Trains. And if you've never seen that book, I would encourage you to get it, check it out. It's got a lot of good information. But this is an example of the fascial bands that exist in the body. This is what's called the superficial back line. It's the way Myers describes it. And if you notice, they're running parallel on either side of the spine. So depending on their tension, and if the tension's balanced, you can start to pull the spine to one side or another. More than that, if you have a spine that is being injured through compression, expansion of this band of fascia will actually lengthen and decompress the spine and take the force off the discs. There's also a band of fascia that is like this zigzag, same thing. I mean, think of that as a scissors jack, right? If we can get that fascia to do this, then we're going to lift and separate the spinal column that lies between it. At least that's the goal. All right, so we covered a lot there. Just to give you sort of a wrap up, the spinal column is a lot of bones called vertebra stacked on top of each other, separated by cushions called discs, supported by muscles, but, and this is most important, suspended in fascia. All right. Well, thanks for sticking with this. And we're going to move into part 2, which is basically when you have that many parts, what could possibly go wrong? Welcome back to Triscale Massage and Body Work, using the Wu Chi posture to decompress the spine. My name is Bill Bryan. I'm a Pennsylvania licensed massage therapist. I've been in practice now since 2001. I've seen a lot of back injuries, and one of the questions that I always get is, what can I do on my own so that I can get off the medications and so that I can, hopefully avoid surgery? And that's what we're looking at. So thank you for being patient. If you watched the full first part, it was all anatomy, it was all physiology, it's kind of the boring stuff, but I think it's absolutely necessary to understand how we're put together so that we understand what happens when the parts aren't functioning properly. And that brings us to part 2, pathology. Pathology, this word comes from 2 words, pathos, which means there's something wrong, and ology, L-O-G-Y, logic, the reason for it, how to understand it. So pathology is how to understand what happens when something goes wrong. And that's where we are. When we have an injury, we don't understand the injury. So we go to the professionals, we go to the experts, and oftentimes they give us a bunch of words that we don't understand either. So we're left trying to pretty much fix a problem that we don't understand any more of now than we did then. So just as a quick reminder, the purpose of these lectures is not to override a doctor's recommendation. It's not to give you the means to self-diagnose. The point is, when we get the MRI, when we get the explanations for why we're in pain or discomfort, if we can just understand what's on the paper so that we can make better decisions, so that we can better understand what it is that the doctors and the experts are telling us. Okay, so this is not meant to replace professional advice. It's just to help you understand better what that advice is, and maybe to get you to ask better questions about, well, what about this? Or, hey, could we try that? Or is this my only option? Okay, so that's the point of these talks. That's my disclaimer right there. All right, so let's get back into looking at back injuries. If you remember, the back column, the spinal column, what some people call the backbone, is actually a series of bones. There are 24 vertebrae, 7 in the neck, 12 in the thoracic, and 5 in the lower back, the lumbar region. Then we get into the sacrum, which is 5 bones fused together. Then we get into the coccyx, which is 4 bones fused together. So we're looking at 33 bones that have to function and operate together without any impedance. And these bones are separated by discs that act as cushions and shock absorbers. That's where most of the injuries come in that we're dealing with. Every now and again, sure, you can have a broken bone, you know, or a compression fracture on the body of the vertebra. That happens. Most of the times, though, the injuries involve the discs, and they involve an alignment of the spine, of the spinal column. Went the wrong direction there. We also looked at the muscular system, skeletal muscle. And if you remember, we had fast twitch muscles, rotatories, multifidi, and others that attach to the little wings on the vertebra, what we call the processes, transverse processes, stick off to the side on the transverse plane, and the spinous process is what sticks out the back. It's the part you can feel and palpate, the bumps. They're actually the spinous processes. And these fast twitch muscles attach themselves in a Z shape or a truss shape, truss configuration, to make all these little micro adjustments that are on an unconscious level. You're not even aware that these muscles are working. They're fast twitch muscles. We also looked at the muscle group that runs up alongside of the spinal column, and they're slow twitch muscles. They're involved in motor nerves, motor skills, conscious movement. So the fast twitch muscles and the slow twitch muscles work together to keep the spine erect. That's why these muscles, the big long ones, I'm not picturing them here, but the long muscles are called the erector spinae group. Erector meaning erect, spinae meaning spine. So Latin, there you go. Erector spinae keeps the spine straight. These fast twitch muscles will come into play. We said that they're unconsciously operated or triggered, engaged, maybe that's the better word. We're going to find that when we get to part 3 in the Wu Chi posture, that our imagination will actually activate these muscles. And this is why the Wu Chi posture is so powerful, and it's subtle, but it's not simple. So, okay, what else do we talk about? We've got all these bones. They're kept straight by the muscles. They are also kept straight by the fascial system. The fascial system is the largest and probably the most ignored organ system in our body. It has many roles. We talked briefly on them in part 1, but the main function that we're kind of zeroing in on is the role that it plays in tensegrity. And tensegrity means, it's 2 words, tension and integrity. They combine them, tensegrity, meaning that by equal tension, the body takes shape. I don't know if you've ever been inside the Statue of Liberty. I was there when I was a wee lad, back in an 8th grade field trip or something. But up inside that huge statue, are all these cables and rods and big steel structures that pull one side against the other side, and they give it tensegrity. If you notice, the Statue of Liberty does not have any guide wires on it. All of its tensegrity comes from within. So too, our bodies have a fascial system. It's ignored, not deliberately, but the way we study anatomy in the West is by dissection of cadavers. And when we open up a cadaver, the first thing you have to get out of the way to study what's inside is all that connective tissue. So they pull all that aside and dump it on the floor. So our understanding of anatomy and physiology is often lacking the necessary knowledge of the biggest structural contributor in our body, which is our fascial system. And we discussed briefly that the fascial system, while it permeates every part of the being, it also grows in bands. It has kind of assigned tasks, and it develops accordingly. So we will be looking in the Wu Chi posture at the role of fascia, particularly as it affects this band of fascia that grows along either side of the spine. My belief is that the fascial system can expand and contract, and when it does, it can not only support but lift and separate the spinal column, which takes the tension off of the injuries that we're going to be looking at. So, where the fascial system goes, the bones go. That's probably the most important thing to take away from this. All right, let's look at some pathologies of the back. Let's look at the osises. We have lordosis, kyphosis, and scoliosis. Probably everyone's heard of scoliosis. Not too many people have heard of kyphosis or lordosis. Lordosis, if you look at this individual here, the pelvis, which is kind of bowl-shaped, but a bowl like on its side, okay? Lordosis is what happens when that bowl tips back. So it's called an anteriorly tilt. When that happens, the low back here starts to increase its curvature. Remember we talked about the curvature, and the importance of the curvature is that it acts as a kind of a compression spring. In lordosis, we're kicking the back, the buttocks basically is jutting out, and this creates a different alignment in the low back. There are some really big words like spondylolisthesis and all these things that can happen. We'll talk about subluxations in a bit, but when the back kicks like this, sometimes it's because there's so much tension here on the psoas muscle that it's pulling the low back forward, which causes the buttocks to kick back. Sometimes that can cause these lower lumbar vertebrae to kick forward, and that creates a lot of problems. So, like I said, we'll look at that when we talk about subluxations. Our next osis is the kyphosis. Kyphosis is kind of like head forward, run amok. Okay? I think we mentioned, I can't remember in part one, but the human head weighs about 10 to 12 pounds. And every inch that it kicks forward, you add an additional 10 pounds to the weight of the head, subjectively speaking, on these muscles that are trying to hold our head upward. As this head goes forward, and this happens a lot when we're texting or typing or driving, And if you even look at cars, the way their seats, they lean back and then they got this headrest that kicks forward. I have my lazy boy chair upstairs, same thing, the back kicks forward. We sleep on pillows. So we are constantly holding kind of like a head forward posture. And when we do that, when this head starts to come forward, we're giving more surface for gravity to get a hold of. So gravity starts pulling us forward. Eventually, the entire spinal column, all of those 7 vertical cervical vertebra, getting down into the thoracic vertebra, starts to crane forward. When that happens, now we're giving gravity even more surface to pull us forward. And have you ever seen people that it looks like their head is like growing out of their chest? That's kyphosis. Our last osis is scoliosis, and that's when the back has kind of an S or a C curvature in the spine. The back is supposed to have curvature this way. It's not supposed to have curvature this way. I've seen this a lot, especially in young women when they get to be 7th or 8th grade and they're really growing and shooting up and getting tall and taller maybe than their friends or the boys, and for whatever social constraints and ideologies are placed on how we're supposed to look and be. If you're tall and thin and taller than everybody else at that age, for some reason, these young ladies don't want to stand out. They don't want to be recognized as being so tall. And I've seen this a lot. So they develop this posture where they kind of hunch the shoulders forward and they stoop down. I don't know if you can see my full posture here, but it's kind of going from here to here because they want to make themselves more equal to their friends. And when they do that, a lot of times the spine starts to compress this way. So some of this is postural. There's a lot of debate over whether or not these osises are genetic and inherited or whether it's postural. I lean towards postural. But again, that's kind of neither here nor there. The fact is, if you end up being diagnosed with scoliosis, your back has such an extreme curvature that a doctor says, hey, we need to do something about this. Again, the effects of gravity aren't going to make that go away. It's only going to complicate it. Because now that we've got this curvature, as the compression is happening, this, let's say on this individual, the spinal column will start kicking more and more out of alignment. These osises are important not just because the x-ray shows that your back doesn't look like the textbook model, but they matter in the area of physiology. Remember, we said anatomy is the name of the parts. Physiology is the understanding of how these parts function and work together as a team. And when you have misalignments like this, you're going to have a lot of issues with articulation. If you remember, articulation is how bones hinge together, how they function. When we get into, best way to put this, if vertebra, let's bring Spiny Norman up here. If the vertebra are meant to be in alignment and to hinge and twist according to those properties, when we change the alignment, let's go to the kyphosis. I see that a lot. We're going to, now we have this kind of a structure, right? But the skull still wants to stay level, because if the spine cranes forward, I'm looking at the ground. But I don't want to look at the ground. I want to look at where I'm going. So I kick the head back up. That changes the alignment between C1 and C2 in particular. So that now, instead of pivoting as it should, with the head forward, it's now grinding in the back and gapped in the front. So now we have a misalignment of force that will directly affect the discs, because the discs are going to take the brunt of that misalignment. They're trying to cushion force that should be coming straight up and down, and instead it's kind of coming in at an angle, but the gravity's still straight up and down. This is where our degenerative discs, this is where our injuries can come from. In the low back, let's go back to lordosis. If these lumbar are meant to pivot on a more vertical axis, and we tip that axis forward, and then we crank it back, and then we try to rotate, we're getting a shearing force in the back while things are gapping in the front. So these conditions are critical to how we turn, how we move, and the discs are going to receive the full brunt of that. All right, well, let's, since we talked about discs, oh, I did say I was going to mention subluxations. A subluxation is when one vertebra in particular comes out of alignment. So the osises, the lordosis, the kyphosis, the scoliosis, is when the whole spinal column is in a weird alignment. A subluxation is when you just have one vertebra. Usually this is more the result of an acute injury. Not always, but normally. And I've had these, and they're no fun. So you twist the wrong way, or you're in a car accident, there's sudden impact, and it knocks a vertebra out of alignment. This is normally when I hand off to a really skilled, decent chiropractor, because they're trained in finding one bone out of the 24 that's not where it should be, and hey, let's put that back in. That's called an adjustment. I'll do a talk sometime on the 3 types of chiropractors that I've come across. But basically, if you have a chiropractor that is knowledgeable, is gentle, gentle's big, and they can work this vertebra back in place, that's worth pots of gold, really is. I'd herniated 2 discs back when I was doing carpentry, and I think it was like L4 and L5. So long ago, I can't even remember. But I had a very good chiropractor who was able to work that vertebra back into place so that the body could heal itself and repair itself. So I didn't need surgery. I didn't need, I wasn't doing pain medication and things like that. So anyway, that's a subluxation. So you ever see that on an MRI, then that's what they're talking about. It's not the whole back that's out of alignment. It's just one vertebra that's kicked. All right, let's look at these, how these types of injuries can affect discs. Up top here, we have the normal disc. We talked about that in part 1. It's fibrous tissue that wraps around, and in the middle is this kind of a jelly, and that jelly stays sort of centralized, but depending on the force that's placed upon it, it will spread out, and it acts as, these 2 things together act as a cushion. It's a shock absorber. Otherwise, you'd have bone on bone. That's not recommended. So the first thing we see is the degenerative disc. Degenerative means it's breaking down. It's falling apart. What would cause a disc to do that? I don't believe it's genetical. There's a word. I don't believe it's genetics. I think it's forces that are being applied to the disc in a way that the disc is not meant to receive the force. So I mentioned shearing force. Shearing force is very big. It makes it so that too much force is on one side of the disc and not enough force on the other, and then it's grinding. And that will start to break down the fibrous tissue that makes up the disc. It'll just grind it away. Think of a door hinge, and you know how little kids like to hang on the doorknobs and swing on the doors, and the parents are like, will you stop doing that? Well, that's because when they put that added weight on the door hinge, it kicks the hinge out of alignment and it can damage the hinge. So the same thing happens. Degenerative disc, I believe, is normally posturally caused because of the way the bones are articulating. If you remember, the articulation site is back here, right? So the whole body and the discs are independent going along for the ride. The hinging is back here. If this alignment is changed, this is going to hinge and it's going to grind on the disc. The next thing that we get is the bulging disc. The bulging disc can also be caused from misalignment. The way the bones are articulating can force the disc out of its space. Bulging disc can also come from continual overcompression of the spine. We haven't talked much about gravity, but gravity is a force that is ever with us, and it is always pulling us down to the earth. Depending on our alignment, that force can start to move the disc in one direction or another. A lot of times on an MRI, it will list certain discs and it'll say slight bulge here. A lot of us have bulging discs and we're not even aware of it. And they may not even be a problem. It's just how we are. I mean, it's not ideal, but it's not an issue until the MRI says, hey, we found this. And that's because sometimes the discs will bulge out towards the front or maybe off to the side. It'll be a lateral bulge. When the bulging disc becomes a problem is when it bulges back into the area of the spinal, where the spinal cord is, in the spinal canal. Normally, it doesn't go straight back into the spinal cord because it's not shown here, and we didn't go into all this because I just tried to get the basic anatomy parts. I left a lot out. But one of the things I left out is there are ligaments that run back through here. Okay, right behind the spinal column, there's a band of ligament. So often what happens is when the disc bulges back, it's going to hit that ligament and stop. And on the other side of that ligament is the spinal cord. So it shoots off to the side. And if you remembered in part one, when we looked at the spinal canal, it was kind of triangular shaped. So often the disc isn't going to bulge straight into it. It's going to go around the ligament and shoot off to the left or to the right. It's going to shoot off laterally. And if you remember, this area is called the neural foramen. This is where the nerve roots leave the spinal cord and go out to the rest of your body. That's usually the area where the disc will bulge into. It starts kissing up to that nerve root, and then you start getting the referred pain patterns. If it's in the lower lumbar vertebra, you're getting the sciatic pain down the leg. It can be, depending on which nerve root is being triggered, maybe the pain is on the top of the foot, and there's 3 different areas of the foot. And a good chiropractor or neurologist will know, depending on where the referred pain pattern is, which nerve root is being affected. So anyway, back to bulging discs. A bulging disc is when, whether by compression or shearing force, or a combination of the two usually, this bulge will kick back and start hitting the nerve root. Next disc injury is the herniated disc. Herniated disc is the bulging disc on steroids. We talked about the jelly. When the disc is so compressed that the fibers that run around the concentric cylinders there tear, the jelly comes out. And again, it doesn't usually go straight back into the spinal column. It kicks off to one side or the other around the ligament and starts kissing up to these nerve roots. That's a very serious injury, very painful, and you know it. Like that's more than just, this is kind of uncomfortable. It's like people have a hard time walking. If they're in bed, it takes them maybe 10, 15, 20 minutes to get out of bed in the morning because every time they move, their body locks up in spasm to protect. So herniated discs, certainly worth avoiding. I've had them. I don't recommend them. There's better ways to get attention. The last thing we have is the thinning disc. And the thinning disc doesn't sound so bad, right? There's no actual injury to the disc. It's just getting thinner. Well, that can be caused by a couple things. One, compression. And often the thinning disc is the result of dehydration because our bodies need fluid. You know, we have automobiles and we're always checking the fluids, the oil and the brake fluid and transmission fluid. And well, our bodies are no different. We need fluid. This fascia stuff that we're talking about is suspended. It's a bunch of fibers and it's suspended in a jelly. And if we're dehydrated, that jelly starts getting hard and thick. That will lend itself to restrictive range of motion. Well, the same thing with the thinning disc. When we're dehydrated, the jelly in the disc starts to harden up and all of a sudden the compression, the ability to compress, to absorb compression and come back when the compression is off, disappears. The compression squishes it down and there's nothing to inflate it from the inside. So a thinning disc, while not immediately causing you discomfort, will eventually turn into a degenerative disc as the body's grinding on this thing and it's not able to absorb the force. And you know, you start getting down to like bone on bone, and believe me, there's no guessing about that. Once you've hit that point, it's much harder to correct the situation, right? So I like to head these things off at the pass before they become an issue. Proper alignment, proper hydration, posture is the way to avoid these things, I believe. Okay, what do we got next here? Let's look at some bone issues. Right now we've been looking at the discs. There are things that can happen with the bones themselves. If you look at an MRI, you'll see osseous outgrowth. Osseous means bone. So in layman's terms, they call it a bone spur. Here we have the spinal column again, right? The body of the vertebra, the discs that serve as the compression fittings. Then we have where the bones articulate back here. This is the hinging part. We have the spinal column running up through the center with its roots coming out of the neural foramen and heading off to various parts of the body. Bone spurring, osseous outgrowths. If it's the body of the vertebra, what happens is you get these little jagged pieces. Instead of it being smooth, it gets rough. The bone starts to grow out, and there's a lot of reasons for that, and we're not going to go into all that here. But the end result is you now have a jagged edge grinding into that disc. There's degenerative disc, right? That's going to wear it away. If it's near the back where the nerve root is, all of a sudden you've got this jagged edge kind of scratching the nerve. That's going to give you a pain signal, going to set off an alarm. And also back here where the bone in the facets where the bones articulate, instead of having a nice kind of a smooth ball and socket move, now there's these jagged edges, these little teeth digging into the joint. So that's going to disrupt the cartilage that's in there, and things aren't going to function properly. They're not going to glide. That's going to set off pain signals. So when it comes to bone spurs, as a massage therapist, I wished I had some technique to work on people and make the bone spurs go away. I don't know of any. If they're out there, you know, I appreciate your input. Generally speaking, when you're getting into bone spurs, you're either going to manage the spurs, which I think the Wu Chi posture does a decent job of, or you're looking at surgery where they get in there and actually file down the bone spur. I guess in some cases that's the way to go. I've seen people with bone spurs up in the shoulder joint and stuff like that, and they can get in and file that away. But it still compromises the joint. So what I'm trying to offer is, okay, if we have some of these osseous outgrowths, is there a way through our posture that we can alleviate some of the pressure on that compromised joint? I believe there is. What else do we have to know here? I want to revisit, I mentioned surgical approaches to injuries, particularly kyphosis and especially scoliosis, or severe subluxations. I mentioned spondylolisthesiosis, where the lower lumbar vertebra actually kicks forward. And there are surgical approaches to this, and I'm not saying that these are always a bad idea or that you should never go this route. There's a time and a place for them. I think especially acute injuries where there's an automobile accident or there's sudden trauma to the body, really the only option left to you is get the surgery or be in a wheelchair. So there's a time and a place for these. But so many of our injuries are postural. It's how we relate to gravity. It's how we move and what posture we're in all day long that cause a lot of the injuries I mentioned. So this talk is approaching more the postural injuries that can be solved by adjusting and changing your posture over time. So most typical surgical approach to back injuries is called a fusion. And what they do in a fusion, you know, like let's say you've got, you know, a disc here and it's herniated and it's pushing into the nerve root we can see up, right? So they take out the disc. They either take it all out or they do a partial, but they give you a discectomy. Removeectomy means to cut off. So a discectomy, we're going to take out the disc. Then they replace the disc with a piece of bone, with the idea that over time, the bone, because bone is always growing, right? The vertebra on top and the vertebra on the bottom will, with this bone in the middle, will just all fuse together and grow together and become one bone. That's a fusion. And to help facilitate that, they take some plates and screws and they actually screw them into the vertebra to lock these two independent bones, to lock them together so that the bone fusion can take place. Obviously, when you're introducing hardware into human anatomy, into human physiology, things change. Stuff that is supposed to articulate no longer articulates. Like I said, there's a time and a place for the extreme approach, but I do not believe that it should be our first go-to, especially when it comes to postural injuries and things that can be corrected just by adjusting our relationship to gravity. I've had clients with rods like this where they take the entire column, in this case the cervical vertebra, and they run a rod right down the lamella groove, the lamina groove, lamella, I like making up words, the lamina groove, and that locks that vertebra, all of them, in place. That may solve an immediate problem, but it causes more problems down the road. The other, and this is a typical place for fusion, is down in the lower lumbar region. And same thing, here's the back. Okay, so you're looking at the back of the individual, the posterior view. And here's the rods, called Harrington rods. And in the front, the anterior view, they place a plate with screws, locks that all together. Low back fusions have a way of growing. And what I mean by that is, I've had a lot of clients who got a fusion at L5-S1, fifth lower vertebra to the sacrum. But then later you find they had to go back for a fusion between L4 and L5. And then in a couple more years, you find out that they have to go back to get a fusion between L3 and L4. And the reason these fusions grow, if you remember, the spinal column is a weight-supporting structure. The lower lumbar vertebrae have the most of that weight, and the tensegrity is what keeps the pressure off the discs as much as possible. Once we put in rods, the rotatory, the multifidi, the fascia, everything that's supporting this column really isn't needed anymore. The rods are doing all the work. So these tissues atrophy. And as they atrophy, compression on the spine increases. So whereas originally maybe I had an acute injury here and I got the fusion, now I'm getting injuries from a long-term, as muscles, as structures atrophy and the compression is coming down harder on those discs. Now I have to keep going back and getting more fusions, more fusions. That's what we're trying to avoid here. So, in conclusion, I believe that it is possible to decompress the spine using this discipline of Qigong, and particularly I'm lifting one movement, the most basic movement of Qigong, and applying it to spinal compression and spinal injuries. Is it going to take away a bone spur? No. But if we can take the pressure off of, if we can reduce the compression, that's going to benefit. Is it going to push a disc back in place? Is it going to push a subluxation back into alignment? No. But I believe through decompression, we can create the space. We can create the conditions for the body to pull the disc back into place, for the body to pull the vertebra back into place. Remember, the body is always trying to repair itself. It is always looking for homeostasis, equilibrium. It has a built-in program for where it ought to be and how it ought to be functioning. If we can give the body the right conditions for it to start doing what it knows how to do, we will be ahead of the game. I am a firm believer in situation desperate, not hopeless. Because of that, because of the body's ability to repair itself. The downside of that is it requires patience. It requires knowledge and understanding. This is why I spent so much time with anatomy and physiology and the pathology, because this is your temple. You need to know if it's falling apart, stop blaming age. Blame your posture. Blame how you move. Blame how you don't move. It may not be genetical. It might be postural. And if that's the case, why not tap into that? Why not make use of what your body knows how to do? Give it the right conditions for it to repair itself. I truly believe that if we do that, we can not only prevent injuries, we can reduce them, we can manage them, possibly even heal them. That's my story, and I'm sticking to it. So we're going to get into part 3, the Wu Chi posture. How to be in alignment with gravity no matter what we're doing. Standing, sitting, walking, even laying down. We can be in proper alignment. We can take charge and control of that to our body's benefit. So thanks again for watching. We are going to move right into part 3, the Wu Chi posture. And by the time you're done that, you'll know exactly what Wu Chi means. So see you in the next episode. Hey, welcome back everybody. We are finally to part 3, the Wu Chi posture. We've stuck it out through the anatomy. We stuck through the physiology. You even made it through pathology. Good for you. A lot of people don't want to do that. They want to get right to the end of the book. But like I said, this is not going to make sense unless you understand how the parts are put together, how they're meant to work, and what's happening when they're not working properly. So let's talk about Wu Chi. Wu Chi comes to us from 2 disciplines, Qigong and Tai Chi. Qigong is actually a self-care routine, whereas Tai Chi is a martial art. But they both use a lot of the same techniques. They're tapping into the same resources. So for that reason, Wu Chi posture is important to both. Wu Chi, well, it's a posture, okay? And I want to emphasize this. It's not an exercise. When my clients are asking me, is there anything I can do for my back issues? A lot of times they're asking me, what exercises can I do? And I always tell them, I don't want you to do exercises. This is not about strengthening your back or even strengthening your core. What we need to do is balance the tension in the muscles, in the fascia. We have to create equilibrium, okay, balance. And that's not necessarily going to come from exercising. It comes from posturing. Once you get used to being in this posture, anyone with head forward issues, anyone with bulging disc issues, anyone with herniated discs, osseous outgrowths, right? Bone spurs, and even narrowing of the foramen is going to benefit from this posture, because if we use this posture properly, we are creating tension on the vertebrae. We are going to decompress the spine. I mentioned the neural foramen earlier in anatomy, and if you remember, that's the opening where the nerves come out. Well, that's not like a hole in the vertebrae. That space, that opening is made from where 2 vertebrae come together. There's a gap on one and a gap on the other, and they line up to create that space. So if our discs are compressed, and if we have degenerative disc disease or thinning discs, the foramen, the top half, will get closer to the bottom half, and we'll get narrowing of the foramen. So narrowing of the foramen is not always a stenosis, which is where a hole actually does start closing in on itself. Narrowing of the foramen can happen with compressed discs. So if we can use this Wu Chi posture to decompress our spine, it's going to open up the foramen, create some more room for the nerves. All right, so let's get right into this Wu Chi posture. I've talked enough about it. It's time to do it. So Wu Chi means where nothing is happening and yet everything is happening. That sounds like a contradiction, but once we study this, you'll understand what I mean. It's just a posture by which we stand in alignment with gravity. It's that simple. And yet it is very complex because it takes into account all the joints in the body, all the musculature in the body, all the fascia in the body, and the skeletal system. Every part of you, it even extends beyond your physical self to your emotional self, to the more abstract parts of our being. So this Wu Chi posture, like I said, I think in part one, it's not simple, but it's subtle. It's very powerful. We begin, and you can't see my feet here at this angle, but my feet are going to be shoulder width apart. And when you look down at your feet, notice if they're parallel or if they're flared out. We want our feet to be as parallel as comfortably possible. When we bring our feet into a parallel position, you might notice, especially if you're used to standing with your feet, you know, what they call duck foot. When you bring those feet in, sometimes it's going to bring the knees in. So then you have to bring the knees back out. But we want to start with our feet parallel and shoulder width apart. And then we're going to move up to the knees and we want to unlock the knees. We don't want to bend the knees. When I first started learning this posture, I used to bend the knees. And if you go on YouTube, you'll see a lot of people demonstrating Wu Chi with the knees real bent. And it looks cool, but you'll get shin splints doing it and it hurts. So don't do that. You want to be able to look over your knees and see your toes. If the knees are covering your feet and you can't see your toes, you're too far. So we don't want to lock the knees out. We don't want to bend the knees. We just want to unlock the knees. And you'll know you've unlocked the knees if you can contract your quadriceps and cause your kneecaps to ride up and down. So feet shoulder width apart, parallel as possible, knees unlocked. We now move up to the pelvis. And this is where a lot is going to be happening. We're not used to unlocking our pelvis, but if you remember from the pathology section where we talked about lordosis and anteriorly tipped pelvises, we want to bring that pelvis into a neutral position so it's not tipping forward. And the easiest way to do that is to focus on the tailbone. You just want to tuck the tailbone in a little bit, not a whole bunch. You know, we don't want to look like grandpa, but we just want to. But you know, we don't want the pelvis kicked this way either. We want to just bring the tailbone underneath and bring that pelvis back in alignment. Then, while we're doing that, I want you to pay attention to your feet. Because depending on how you tip your pelvis, you're going to start to go forward or backward on your feet. So you want the full weight of the pelvis to come down in alignment with pretty much like the arch of your foot, okay, between the heel and the balls of your feet. If you're leaning too far forward, you'll know because you're your toes will be grabbing the floor to keep from pitching forward. And if you're leaning too far backwards, you'll know, because you'll rock up on your heel and your toes will come up off the floor. You want equal pressure on the balls of your feet and your heel. In Qigong and in Tai Chi, this area is called the bubbling well. And the trick is, to get in alignment with gravity, we want our entire body, all the weight, to go right down and into that bubbling well. So as we're adjusting our pelvis, we're kind of guiding where the force goes, whether it's shooting out in front of us or whether it's shooting out behind us. We want to tip the pelvis and relax into it until we feel like we have all our forces right between the balls of the feet and the heels, and equally on both sides. Do you see what I mean by this is not necessarily simple? Once we are in that position, we can now start to focus on the spine and the shoulders. Take the shoulders and just let them relax. We shouldn't be holding them up. We shouldn't have any tension in our shoulders. We just want them to drop and relax and sort of hang off of our body. Our arms should not have any tension. They should be like cooked spaghetti. Okay? There should be no tension in our fingers, in our elbows. All should be loose. At this point, I want us to drop our chin and ramp our head back just a little bit. Don't force it. Okay, we're just going to ramp it back. So if you're in this position here, drop the chin, bring the head back just a little bit. We want to try and get the ears over the shoulders as much as possible. You may feel a slight stretch coming in here. That's okay. The goal is not to, force our head where it doesn't want to go. We want to just start working our head back into alignment. When we do that, we drop the chest a little bit. And the reason I say that is sometimes when we ramp the head back, people do this. Okay, so that's not actually ramping the head back because the angle is staying the same. We're just pivoting it. By dropping the chin and ramping the head back, now we're bringing that cervical vertebra back into alignment with gravity. When the shoulders are relaxed, we want to take the hands, and they're going to just be comfortably like to your sides, maybe turn back a little bit, but not much. The main thing there is you want a slight gap between, like in your armpit. Pretend like you're holding an egg there. You want to hold it without dropping it to the floor, but you don't want to crush the egg either. So the arms are just dropped, relaxed. The chin is down, head ramped back. We're checking in with the pelvis again. Tuck the tailbone under. See where your weight is balanced over your feet. And if you feel like you're pretty much got it, then what's happening is you're in alignment with gravity. And you'll notice that it won't be as much effort to stand. All the muscles will be equally balanced. That's when we enter into the breath work part of this. The breath work is important because, think about this, if we're dealing with back injuries, every time you take a deep breath in, those lungs are pushing back against your back. It's almost like massaging the back from the inside. It's also going to help relax the body. When we breathe properly, the body goes into a state of relaxation, which is absolutely necessary if we're going to decompress the spine using the fascial system and fast twitch muscles. Everything has to be relaxed. If we're holding tension, then we're not going to be able to move out of that posture. So our breath work allows us to relax into this posture. Here's the way we're going to do the breath work. We always start with the breath out. And we're going to breathe in through the nose, pretending like you're breathing into your belly. We know it's going into the lungs, but let's pretend like the air is going into our stomach, so that when we take a breath in, the stomach expands. So we're going to breathe in through the nose. And then exhale through the mouth. And let the stomach cave back into the back, your backbone. When we breathe in through the nose, we're only filling up maybe about 80% capacity. So the goal is not to get as much air in as possible. It has to be a relaxed breath. So 80% roughly, give or take, right? Breathe in. And then we hold it for a little bit. And then we breathe out through the mouth. 80%. And then we hold it. When the breath work is done properly, it should sound like ocean waves. So like picture, you know, you're at the shore and the tide's coming in and you hear this nice small thought on breath. When I have clients on the table and I always start my sessions off, I say, okay, take 3 deep breaths. And I can tell by their breathing how much tension they're holding in their body, how much stress is going on in their world. Sometimes, you know, I'll say take 3 deep breaths and I get like these guys are running a marathon. And, you know, if you take that to the analogy of the ocean, if the waves are coming in that fast, there's a storm out at sea. So fast and sudden, usually the sign that we're holding tension, too much stress in our bodies. This breath work literally throws the switches from your body's orthosympathetic nervous system to its parasympathetic nervous system, from your fight or flight system to your relaxation system. And it's the breath work that's the key to this. So let's start over again. This time we're going to incorporate the breath work, and then we're going to throw in the last piece, which is the most important part of this entire posture when it comes to decompression. So feet shoulder width apart, parallel, knees not bent but unlocked, pelvis in a neutral position. We're going to tuck the tailbone under just a little bit, get a nice little stretch in the low back. We're going to hang our arms off of our shoulder girdle so there's no tension in the shoulders or the arms. And then we're going to check back in again. Where are we in relationship to our feet? We've got equal weight on each foot, left and right, and our weight is over the bubbling well, that point in the arches between the ball of the feet and the heel. Then we're going to drop the chin down and ramp the head back just a little bit so the shoulders are more directly under the ears. Now we're going to do our breath work. Start with an exhale. Breath in. Breath out. Breath in. Breath out. Check in with where your weight is over your feet. Are you still centered? At this point, I want you to start to feel grounded to the floor through your feet, where your feet are almost like the roots of a tree. They're really connected to the floor. So every time we breathe in and breathe out, we're sinking a little heavier into our feet. We're not sinking down literally. We're just focusing more on our weight and its contact with the soles of our feet. So breath in, breath out, sink into your feet. And then we're going to add the imagination part. The imagination part of this exercise involves pretending like there's a string that's attached to the crown of your head and lifting you towards the ceiling. I know it sounds weird that I'm talking about using your imagination. The reason this works is because it's our imagination, it's our thought life that causes our fascial system to recalibrate, and it is our thought life that can trigger those fast twitch muscles that we don't have conscious control over. If you remember in anatomy, we have slow twitch muscles that are related to conscious thought. And then we have fast twitch muscles, which are constantly reacting to stimulus faster than we can even process it. They're on automatic. Well, they respond to your imagination. Here's a little test to show you that, I'm not making this stuff up. Have you ever found yourself driving to work and thinking about an argument that you had a couple days ago or maybe a couple years ago? And when you bring that memory back up and you start replaying the scene, your body will start to tighten up. Your blood pressure will rise. Your teeth, you'll clench your jaw. Every physiological response that you had to that argument or that confrontation will come to life again just using your imagination. It is such a part of our being and our personality that we overlook it. We're not even aware of how much it governs our actions and our behavior. But our thought life is a very powerful tool when it comes to controlling all the physiological responses that are taking place in our body. So what we're doing here is we are deliberately tapping into that and using our imagination. If we pretend, if we imagine being lifted from the crown of our head by a string, the better our imagination, the more we will actually start to feel it. And that's because the more we imagine, the more the fascia is going to start opening up. The more those fast twitch muscles are going to start making little micro adjustments. We will actually be decompressing the spine, separating vertebra from vertebra, taking pressure off the discs by using our imagination. This is why the first part of this Wu Chi posture is so important, getting in alignment with gravity. The more in alignment with gravity we are, the less all these muscles have to work to keep us upright. So we really want to be in a nice, relaxed, balanced state. When we're in that state, the muscles aren't working as hard. The fascia's not working as hard. Then the imagination takes over and the muscles and the fascia respond. So there is a method to my madness. All right, so as we say in band rehearsal, from the top. Feet shoulder width and parallel. Knees unlocked. Comfortable, not bent. Pelvis, neutral position, tail tucked under a little bit. Shoulders relaxed, arms relaxed. Slight gap between the armpits, but not overly exaggerated, but we're not clamped in either, just good and relaxed. You can let your palms face in or face back just a little bit is okay. Chin dropped and ears over top the shoulders or as close as is comfortable. Check in with your weight. Where are you in relationship to the bubbling well? Now let's start our breath work. Nice deep belly breath in. And breathe out through the mouth. In through the nose. Out through the mouth. Now we're going to incorporate the string. As we breathe in, feel the string starting to lift you very slightly off the floor. And as you breathe out, even more. Breath in, you're being supported by the string. Breath out, you're being lifted. At this point, you should be starting to feel a sense of relaxation in your stance, in your standing. At first, this may be very uncomfortable because your body's not used to standing properly, probably in alignment with gravity. Especially, I mentioned, I think earlier, I used to have a posture that was like foot sticking off to one side, and it was like, it's how the guy stands, Well, when you get used to standing like this and you try to stand into a correct posture, it feels weird. Now, here's the good story and why situation desperate, not hopeless. I'm so used to standing comfortably like this now that when I get into this posture like I used to stand, this is now very uncomfortable to me. So your body will adapt and you can rewrite the program and reset new norms for it. This posture, this Wu Chi posture, I mentioned is not only something you can do when you're standing, even when you're sitting, you can focus on from the pelvis up and pretend like you're being elevated by a string and do your breath work while you're at the computer table, while you're in the car. Okay, this can be done sitting on the couch watching a movie. I mentioned walking around. This is a posture that can be done when you're walking. There's a difference between, every fight you're slamming into gravity, and it's no wonder our joints and our hips give out when you watch how heavy people walk. I know that was exaggerated, but watch sometimes how people come down on their feet, and there's a lot of force. And every time we do that, that's compression on the spine. With the Wu Chi posture, if I am walking as though I'm being suspended by a string, I'm almost gliding across the floor. It's a whole different experience, and it's a lot better on the spine. I think I even mentioned this can be done laying down, and it can. You're in a horizontal position. Pretend like you're being pulled across the bed or, across the couch or whatever by the top of your head, and your spine will elongate. It will open up. So the logic to this is pretty simple. How it works is If we are in alignment with gravity, we are in a state of relaxed balance. And if we are in a relaxed balance, our imagination is able to freely activate our fascial expansion and our fast twitch adjustments. And when all that starts occurring, we are using tensegrity to cause traction on these vertebrae, opening them up, separating them out. Do you see why this would even be good for somebody with Harrington rods? How else are you going to get into that spine and help it to open up when you've got hardware on either side of the vertebrae and gravity is pushing it down? There's no motor nerves, there's no slow twitch muscles that are going to be able to operate that spine because the spine's locked in place. But I believe we can get in and around all those rods using the fascial system, using the fast twitch muscles, bringing them back online to actually extend the vertebrae. I think if you get into this Wu Chi posture, and it is a discipline, it's going to take a while to learn it, so you have to be patient. This is well, it took me about 6 months before I even got comfortable with what I was shooting for. And even there's always something to be tweaked. There's always something that could be brought more into alignment. You can spend your entire life trying to master this posture. I don't think we are really looking to be masters at this point. We just want our back not to hurt so much. So I'm convinced that even if you get any of this and put it to use, you will notice a change in your posture that will result in reduction in pain, possibly even clearing the way for your body to repair itself. If those vertebrae come up off each other, who knows, maybe the disc will make its way back in. If nothing else, we're standing better, we're not working as hard, we're not going to be creating the problems that bad posture creates. It's reducing shearing, it's going to reduce the compression. So there's nothing but good to be gained from this. There's no negative side effects. There's no copay. It's legal. You know, it's just not that hard to get into the Wu Chi posture wherever you are. You just have to understand why you're doing it and what's going to be accomplished by it. Last thing I'll say is the reason I like it is you don't need any extra equipment because you have all the equipment that you need. You've got your body, you've got your temple, right? And like I said, our bodies are a miracle, but it doesn't have to be a mystery. All right, well, thanks for watching. I hope you got something worth getting out of this and that you're able to apply some of these principles to your own injuries. Again, I'm not trying to override what a doctor says. I'm not telling you whether or not you do or do not need surgery. This is not meant as medical advice or as a means of diagnosing yourself. It's just information that's worth having so that when you get the MRI and you get all these big words, you understand what they're talking about, and you can ask better questions and make some decisions concerning your own health based on how you're put together, how you're meant to operate, how we're meant to function. We are carefully and wonderfully made. So I always start from there. Look for the engineering, look for the design, then start figuring out why it's not working the way it's designed to work. You know, it doesn't mean overriding conventional medicine, but sometimes you want to work along with it. A whole lot more could be said on that, but we're gonna leave it here. So thanks for watching. For more information, please visit my website at triscalemassage.com. My name's Bill Bryan, and we'll talk to you later.